Welcome to my YouTube channel. Today, after a long gap, I am back with a new topic. In this video, I am going to discuss pleomorphic adenoma. Let's come into the topic. Pleomorphic adenoma is a benign mixed tumor and is the most common tumor of the parotid gland. Now, I will ask one question about pleomorphic adenoma. Why it is called mixed tumor? According to the histopathology, pleomorphic adenoma contains two different types of cells, such as epithelial cells and myoepithelial cells. These two type cells are mixed together along with a variable stromal component that may appear myxoid, chondroid or fibrous. Because of this mixture of different cell type and variable stromal component, it shows a characteristic mixed appearance. Next is etiology. The exact cause of pleomorphic adenoma is still unknown. However, several predisposing factors can increase the risk of developing this tumor. These include a history of head and neck radiation, certain genetic mutations, smoking, alcohol, and occupational exposure to the chemicals used in rubber manufacturing, asbestos industries, and plumbing work. Now let's discuss the clinical features of pleomorphic adenoma. Pleomorphic adenoma is most commonly seen in the 4th to 6th decade of life and shows a slight female predilection. Clinically, it presents as a slow-growing, painless, firm and non-tender mass. As the tumor increases in size, the swelling may become irregular and nodularity may be felt on palpation. In case of pleomorphic adenoma of parotid gland, additional clinical features can be observed, such as elevation of the ear lobule and a characteristic curtain sign. Curtain sign means the parotid swelling cannot be moved upward beyond the zygomatic process. Next, we will discuss the histopathology. Pleomorphic adenoma is a well circumscribed and encapsulated lesion. Under the microscope, we can see glandular epithelial cells, myoepithelial cells, and a hyalinized eosinophilic mesenchymal stroma. Up next, here you can see the diagnostic imaging of pleomorphic adenoma. This gives a clear idea about the typical appearance of the swelling. First, let's look at the ciliography image. In ciliography, the benign tumor causes displacement of the salivary ducts around it. The lesion appears well delineated and with well-defined margins, producing the characteristic ball in hand appearance. Now, let's explain the CT imaging. In CT, pleomorphic adenoma typically appears as a well-circumscribed, smoothly marginated and homogeneous soft tissue mass. Up next, we will look at the MRI scan. In MRI, pleomorphic adenoma usually shows the features of a benign lesion. It appears as a well-circumscribed homogeneous mass with clear and distinct margins. Next is moving on to the treatment. In pleomorphic adenoma, the treatment of choice is surgical excision. If the tumor is located in the superficial lobe of the parotid gland, the recommended approach is the tumor excision with superficial parotidectomy. For the tumor in the deep lobe, the total conservative parotidectomy is recommended to remove the tumor. This is a short video about pleomorphic adenoma. Please watch and subscribe my YouTube channel. Thank you.